In healthcare billing, small mistakes can cause major payment delays. Nearly 19% of in-network claims are denied on the first submission, and many of those denials are administrative, not clinical. One common and preventable example is denial code CO109. In this video, we'll explain what this denial code means, why it happens, and how it's preventable. A CO109 denial code means the claim was sent to the wrong payer. The insurance company that received the claim believes another insurer is responsible for payment. This does not mean the service is permanently denied. It simply means the claim must be submitted to the correct insurance plan for processing the code. CO109 is a payer responsibility issue. The service may still be covered, just not by the payer that received the claim. Until the claim is routed correctly, reimbursement is delayed. Most denials are not true coding errors. They are usually caused by data or insurance setup issues. Common causes include outdated insurance information, failure to update coverage after a job change, listing the wrong subscriber, coordination of benefits error, or system defaults that automatically send claims to the wrong payer. Even small mistakes in subscriber details or policy numbers can trigger a 109 denial. The risk increases when patients have multiple insurance plans, such as an employer coverage or Medicare, Medicaid, and commercial insurance, or coverage through a spouse. In these cases, proper coordination of benefits determines which plan pays first. If the order is wrong, the claim goes to the wrong payer and comes back denied. Prevention starts at the front end. Revenue cycle teams should verify active insurance coverage before each visit, confirm eligibility dates, check subscriber and dependent details, and clearly document primary and secondary coverage. Accurate coordination of benefits ensures claims are submitted in the correct order. When a payer issues a 109 denial, they've reviewed enrollment records, coverage dates, coordination of benefits data, and determine another insurer should pay first. The provider must then verify the correct coverage, update the record if needed, and then resubmit the claim to the appropriate payer. The patient is not automatically responsible if other active insurance exists. A real-life example would include billing an employer plan when Medicare should have been primary, failing to update insurance after a job change, billing a dependent under the wrong subscriber, or missing workers' compensation coverage. In most cases, the root cause is incomplete verification or incorrect insurance information. Correcting a CO109 denial is straightforward. Verify active coverage, update the electronic health record, confirm coordination of benefits, and resubmit the claim to the correct payer. Acting quickly reduces accounts receivable delays and protects cash flow. To prevent repeat 109 denials, organizations should track denial trends, audit claim submission workflows, review payer rules, and train staff on consistent insurance verification standards. Strong front-end processes reduce rework and improve overall revenue cycle performance. CO109 is highly preventable. It simply signals the claim went to the wrong payer. With accurate insurance verification and careful claim submission, organizations can reduce administrative denials and protect reimbursement. If you'd like to learn more about reducing denials and strengthen your revenue cycle, reach out to Tactics. And since you made this far into the video, you might as well like it, share it, and comment down below.